Embarrassed, a little bit ashamed about having dementia. They feel a little bit self-confident because when they go out with friends and family, they may forget words, they may forget the thread of the story. So they begin to have these challenges and these issues, and it drives up their anxiety. And of course, that makes the symptoms worse because we know fear and anxiety. Acknowledging that I have a cognitive issue. Education. Hi, good morning, good afternoon, good evening, wherever you are in the world. Thank you for joining me with this video today. And I just want to say to the people in the UK, I feel for you being battered by that storm. If it's any consolation, I'm coming to you today from not so sunny Arizona. It's raining, it's misty, it's a little bit foggy, it's damp, and so I feel your pain a little bit. Okay, so today I wanted to talk about a subject we've already spoken about in the past. It's about destigmatizing dementia. And the reason why it's come back into my mind and my thoughts is because some of my patients are actually experiencing that at the moment. They're feeling a little bit embarrassed, a little bit ashamed about having dementia. They feel a little bit self-confident because when they go out with friends and family, they may forget words, they may forget the thread of the story. So they begin to have these challenges and these issues, and it drives up their anxiety. And of course, that makes the symptoms worse because we know fear and anxiety fuel those symptoms. So what can we do about it? Well, there are three key things I want us to focus on when we're supporting people to destigmatize how they're feeling about having a cognitive challenge. Okay, the first one is acknowledging that I have a cognitive issue. The second thing is education. And the third thing is being able to focus on existing strengths, current strengths. So acknowledgement, education, and strengths. Those are the things I want us to focus on. So acknowledgement. It's very difficult when somebody is experiencing and living with any kind of disability, illness, disease, however you want to phrase whatever the challenge is, whatever the person is living with. So when it comes to a neurocognitive disorder, being able to acknowledge it is quite difficult. But once we can get to that point and get to that stage and say, okay, yes, I do have this challenge, and it is a challenge. It is only a small part of who I am. I am still Dr. Dan. I am still that 99% of who I was before. I'm still there. I'm still that person. I just have this particular challenge with a cognitive issue. And of course, everybody's different. Not everybody experiences the same challenges. And there are a whole bunch of different types of neurocognitive disorder, ranging from Alzheimer's disease all the way to the rarer forms of CJD and Huntington's disease and things like that. So everybody's challenges are a little bit different. However, the skills used to acknowledge that I have this challenge are the same. Because we've gone through our life, and it doesn't really matter how old we are. We could be 10 or we could be 100. We've experienced some challenges in our life, and we've developed some tools to use to manage those challenges. So very often it's about dipping into our invisible toolbox, finding the tools we've used in the past, and maybe having to modify them a little bit in order to deal with this situation now. And never, ever, ever be afraid or ashamed or embarrassed to ask for help. There's lots and lots of help and lots of assistance and lots of people who can feed in and give input to supporting you to destigmatize and to rebuild your confidence. So please always ask for help, whoever that may be, ask for help. So that's about acknowledging it. And once you've acknowledged it, you may be able to say to yourself, right, I have living Inside my living room, so imagine your brain is your living room, I have an uninvited guest. And that uninvited guest is a pain in the ass. And sometimes it causes me all kinds of problems, all kinds of challenges. But you know what? I'm in charge of that because I can manage the anxieties and I can manage the fears. So have that kind of mindset. Adopt that kind of mindset. That uninvited guest, yeah, he's there. He's a pain in the ass, but you're in control. You're empowered to take charge. And that way, that pain in the ass can't keep giving you grief and can't keep causing you self-confidence issues and self-esteem issues. The second thing to think about is education. Now, education is key to everything and anything. The more we understand something, the better we are at managing it, at dealing with it, at coping with it. So have a full understanding of what it is you are living with. If it's Alzheimer's disease, and that's 80% of people living with a neurocognitive disorder are living with a form of Alzheimer's disease, think about that, research it, ask questions, learn as much as you can about Alzheimer's disease, and then cross-reference it with your own challenges and look at what it is that has helped other people. Because if there are, let's say, 5 million people in the US living with Alzheimer's disease, and that's around about a good figure, that's around about accurate, those people are experiencing challenges and finding ways to manage and cope. That's what we need to do. Find the ways, seek, think, spend time researching and educate yourself. A little warning there about where you get this information from. Make sure you go to known sources. Make sure you go to your neurologist. Make sure you go to the Alzheimer's Association, the Alzheimer's Society, support groups that are designed specifically for people who are experiencing cognitive challenges. Speak to your dementia specialist. So ask those questions and never be afraid to ask a question. No question is too stupid. I am more than happy to answer any question that people have about their issue and their challenges. Okay, so education is key. And then the third one is strengths. So in the past, when I was in the UK, I would come across care plans in hospitals and nursing homes that focus specifically on people's needs. Didn't talk about their abilities, didn't talk about their strengths, didn't talk about their dreams, didn't talk about their ambitions, didn't talk about their wants and desires. It focused solely on need. So a colleague of mine, a big shout out to Sharon, because I'm sure you'll be watching this vid, Sharon. Sharon and I and a few other team members developed a strategy, a different kind of care planning that focused on people's key strengths and their core strengths. And you can build on that. So it doesn't matter that I've lost this ability to do this particular thing. Because as you know, and if you watch my videos, through brain health coaching and laying down new neuronal pathways, you can actually regain that lost ability, that lost skill, that lost strength. So through Montessori therapy and repetitive muscular activity, you can draw back those skills. So don't even focus, don't get bogged down and don't worry on, I can't do this anymore. Because whatever you tell your brain, it will respond to. It's listening to you. It's listening to your thoughts. So if you're thinking positive, your brain's going to act positive. Okay? So focus on the strengths, focus on what you can do, focus on what you've got, and build on that. So make sure you focus on those strengths. It helps with growing your self-confidence. It helps with growing your self-esteem. And it helps with empowerment. So you get to take control and take charge of what is happening. Okay? You've heard me talk about rementia in the past. And rementia is a phrase that was coined by Professor Tom Kitwood at the University of Bradford back in the late 80s, 90s, when he spoke about being able to regain some of the skills that have been lost for whatever reason. Sometimes another individual de-skills you. Another individual tells you can't do this or you shouldn't do that. So Rementor is about clawing back those skills. So wherever you are in your journey, and whoever you are on that journey, whether you're a caregiver, a doctor, a nurse, a member of the family, the person living with the challenges, whoever you are, wherever you are in that journey, stay positive, remain focused, and acknowledge, educate, and focus on key strengths. So that's the message for today. I just want to ask Lynn, who's with me again today. Good morning, good afternoon, good evening, Lynn.
Hello.
Hi. Yeah, she gets out to be good. This is Lynn. If there's one word that you can use instead of 10, she'll use one word. That's the beauty of our Lynn. You got some questions?
Well, let's say you're the loved one supporting someone living with dementia, and you're in a social setting and you see your loved one struggling, but you don't want to take over the conversation, but what are some skills that would help that person not interfere or take over, but be supportive
For the caregiver.
without making the person feel less than?
Okay, so when we think about people who are experiencing Alzheimer's disease or another form of neurocognitive disorder, we need to remember that it takes a little bit of time for that individual to process what is being said. So where we may be able to rapidly respond to questions and discuss issues and things like that, somebody living with a cognitive challenge needs about a minute to process and then find the correct response. So be patient, take time, step back, give the person space, let the person breathe. Silence is golden. You know, very often in therapy, when you're in a therapy setting, there is a lot of silence. And when you have that silence, people have the time to process what is actually happening and what is being said and where you are going in that conversation in that direction. So patience and time, and let the person speak. Don't push them, don't prompt them, don't interfere unless they give you the sign, because very often people will say, oh, I can't find the word. What is that word? What is the word I'm looking for? And then they're kind of giving you permission to step in and support them and help them and kind of guide them in the correct direction. But give time first, look for body language, follow their cue, and then help and support at their guidance. Okay?
How about sharing the information with close friends? Is that okay to do that and let them know that there's been a diagnosis? I mean, they're gonna notice changes, but where's the line that's okay not to, you don't want to cross the line, but you're trying to be sensitive at the same time.
Well, as you know, Lynn, Nightingale Dementia Consultants, we have this HOT philosophy, being honest, open and transparent. So it's good to have a conversation with that individual and be honest and be open and be transparent and ask them, do you want friends and family to know what your challenges are at this moment in time, what you're dealing with, what you're facing, what journey you're on? Because I want to empower you to have that conversation with the family, with the friends. But it's entirely your choice, your decision, and I support you with what choice and what your decision is. I have some patients who do not want other people to know that they are living with this. Some of them are in a particular work setting and it could be very detrimental in that sense. So it's got to be individual, it's got to be thought about, it's got to be spoken about, it's got to be discussed. And ultimately, the person who is living with that cognitive challenge is the one that needs to take control of whether or not they share that information. But of course, everything we do, we act in the best interests of that person, right? So that's where we are with that. Okay.
Very good.
Anything
That's
else?
some good information.
Perfect. Well, thank you for watching this video. As usual, it'll be useful and helpful for you. And I want to remind you that you can go to our website, drdanielnightingale.com. Follow me on Instagram. Follow me on Facebook. Ask any questions you like through any of those platforms. And remember, guys, what are you going to do? Say it with me. Dump the soda. Have a great week.